See none, hear none. Let's move forward. We're going to go to
Number 4.
number 4. Consider approval of the fiscal year 2021 operating and capital budget. Mr. Ewing.
All this stuff turned on so y'all can hear me. Is that good? Does that work? Okay, let me turn this on. And the PowerPoint. All right, so this is what I will call the official budget presentation. We met at the board a couple weeks ago, and I gave you a primer on where we were going and some of the things that we're looking at. This is where we have finally landed with this year's upcoming budget. So it is for fiscal year 2021. And in it, I do want to talk first about how we got to volume, because volume is sort of the baseline of how we create any budget. You've got to have sort of a budget volume number. And what I think we've got to recognize, and what I read out there in the literature, is that nobody has a good crystal ball on how they see volumes for the next 12 to 24 months. That being the case, it's still, we got to have a number, we got to have to start somewhere, but it has been problematic in trying to determine where our volumes are going to be. We really don't have a vaccine available also, so we're having to deal in the so-called new normal. I think as a hospital management team, we've been able to go through the peak that we had in the July-August time period, and the clinical side of the house has worked through the new normal process of how we handle 20 to 30 patients in-house. That being said, we've had to change some staffing numbers to be able to meet this new need. But if we just get down to the straight method of how we constructed our volumes, we went back and in time, we looked at the October 19 through March 20 time period, that 6 months time period. And March 20 was really the last month in which you could say there was no COVID impact. There was a little bit of an impact in the last week or so of March, but we took those volumes, which we're now going to have to repeat again starting next month, and we took them at 90% of the actuals to create our baseline. So we're basically saying from fiscal year 19's number, we're going to work at 90% of those numbers for the next 6 months. And then we're hopeful that once we get past the flu season, and we're in the April through September time period, that we can move up to 95% of those actuals. And so that's sort of our baseline. And you're going to hear me repeatedly talk about where the fiscal 21 budget is. Typically, we would go to fiscal 20 projection. Many times I'm going to go back to actual 19, fiscal year 19, and in some cases I'm going to go back to fiscal year 18, just to show you the wide range of where we are with all of the numbers that we considered as we put this together. Now, I'm not going to go through all these numbers, but I just wanted to, and they're in your packet that we gave you, but just to give you an idea of where we are, and if we just look at admissions, which is the top line number, we have 13,410 admissions in this budget. 19, we finished at 14,000. 18, we're at 13,600. So you can see our current year projection is even below 2018's number by a couple of hundred. And when we look at where we're going to finish this year, we think we're going to be right at 12,200, 12,300. So that's still a 9.4% increase over 2020 projection, but it is a decrease from prior years. The same with patient days. And if you come down here and you see how all that translates, we were in basically the 180-day average daily census until COVID hit. Then we dropped down. There was, at one point, we were as low as 120 patients in the house. Now we're averaging, we're going to finish the year at 157. And we're saying this budget's going to be constructed on 169 average daily census. You can see that's still a significant decrease from these two prior years. Now, when we look at a lot of the ancillary services, you see much of the same thing. You can see where our radiology inpatient, outpatient is going to be 48,000 and 85,000 images versus 52 and 94. I mean, so we're still struggling to get back up to 2018 numbers. The same with the cath lab, the same with lab. The only line item that we have in this whole budget that shows progressive increases year over year are the deliveries. 1886, 2047, 2133, and 2170. So that particular service line and all those that are related to it, we are seeing a continued increase in that, which is good. Surgery cases, again, we're going to be better than what we finished this year, but you got to remember this year we had 2 months in which we were basically shut down. And we're significantly below the 10,000 case mark on this. And then as another way of looking at where our volumes are, and this is a significant impact, we were in the 52 to 54,000 range mark for ER visits. That's roughly 150 visits a day. I mean, that's where we were averaging, about 150 visits a day. We're going to do 46 this year, but this was all predominantly pre-COVID. We're looking at 42 to 43,000 visits. That's about 110 to 120 on any given day. So, I mean, that is a significant decrease, especially when you consider that the ER many times is the front door to this hospital. And we're looking at a good 20%, 25% off of our ER visits in this year's budget. Now, how does that translate into gross patient revenue? And I'm going to stop here and just make a comment. We, again, this year will not have a rate increase on our gross charges. Typically, you'll see hospitals, they'll raise their rates anywhere from 3 to 6% year over year. Practically all of our contracts don't have a percentage charge built into it. They do have escalators as it relates to the amount they're going to reimburse us, but our gross charges we're not raising, and there's really no benefit to doing that. So when we look at where our revenues are, I don't have to normalize these numbers to make them relative year over year. So we're still billing at the same rate we were in fiscal year 18. So you can see that our gross billings are going to be $1.2 billion this year. It is an increase from our 20 projection, but see where we are versus 19. We're down from 19, and we're only slightly better than fiscal year 18 as far as gross billings. So our overall billings, though up, are still down compared to fiscal year 19. Now, how does that translate into net revenues? We are seeing an increase compared to fiscal year 20 of about 7.2%, or $19 million. And you can see that down here. We're looking at $268 million in net patient revenue plus Medicaid supplemental funding. And we've got a budget of 287. So that's about a $19.3 million increase. But look at where we were in 2019. We were at 290 million. We're still below that. And that's with an additional $11 million in Medicaid supplemental funding. And so this is not an aggressive budget in that we think we're going to get all this revenue coming back into the next year. In fact, I put this comment in here just to make everybody aware that of all the things I see in our budget that is most at risk, it's our revenue cycle. And that right there will either make or break our budget this next year. We'll manage our expenses. I'm confident of that. Our E-team has demonstrated that through this pandemic, that we've been able to manage expenses the way we should. It's the revenue cycle that really concerns me, especially the bad debt cycle piece of that. When you start thinking about all the people that have lost their jobs, don't have insurance, I'm not talking about the old stuff that our revenue cycle partner hasn't collected. I'm talking about starting today, people that show up today that don't have insurance that we're still going to treat. We're going to see an increase in our bad debt expense. We just know that. And I've tried to accommodate some of that, but again, that's making a projection, and it's awful hard just to see where we're going to be with that. But I will tell you that the thing that gives me the most concern in this whole budget is the revenue cycle and its ability to impact our overall cash flow. Now, let's talk about the single largest expense we have in our operating expense, and that's salary, wages, and contract labor benefits. We have put into the budget a 2.5% merit increase for all employees. And we have modeled that with a mid-year, fiscal year mid-year increase. That will have a $1.4 million impact to this organization this year. In the health insurance benefits section, we do show a slight increase of $178,000 in our cost for the year. We've done a fairly good job of controlling our health insurance costs, but they will go up, just even with the reduced workforce we do. We are seeing some of that. We are not asking our employees to contribute any more, except one situation. And this will be the third year in which we have not increased the employees' contribution. And I think that's a commendable thing for this organization, because when you start looking back, there are organization after organization that increases the employees piece year over year. And we haven't made any of those type adjustments. Now, we are going to go up on the spouse side of this by $141 per month. And that still puts us below market on what a lot of other large employers are charging. But in going up, we're also going to allow the spouse to qualify for the wellness discount. Is this me doing that, or I'm going to sit down and see if that. Yeah, I think that's it.
All that energy that's
I don't know, but it's
that gleam.
Maybe the cord.
yeah. Let's get this out and see if I can. That's really loud. How about that? That's a little bit better. I can talk louder as opposed to this. Talking to that mic. All right, let me turn this off. Put it on mute. Okay. Hopefully this, would it be better if I stand over there?
We hear you.
You okay? All right, good. So we are giving our spouses that are part of the plan the option to do the wellness discounts. And if they qualify for both of those, it negates a large part of that $141 a month increase. So yes, we're going to go up, but if they meet the wellness options, then they get to offset that. So it should negate that.
What are those options?
You've got.
I mean, I don't want to all just.
You've got two options. The first one is the attestation for tobacco, if you don't utilize tobacco products, and that gets you, I believe, it's going to be a $50 or $60 per month reduction in the fee. And then, just like all the employees qualify for wellness, if you meet 3 of the 4 wellness items, then you can get the other half of the discount. So they could offset probably about $120 of the $140 increase just by meeting the wellness.
That's like your LDL, your HDL, your waist circumference, which
Your diabetes.
I blow right by that one, but
Yeah.
you know.
Thank God I'm not in
Yeah, yeah. But it's meant to be those that are managing their health can get it. I mean, I'll be honest, I'm borderline. I probably won't get the second one this year because my A1C isn't where it needs to be. So, and it's meant to be those that are truly healthy, because that's how we should see our health insurance plan. The other big change we've got, and I think this is positive for our employees too, is the fact that we're going to go up on the match from 125% to 145% of their contributions starting January 1. So I think that's a nice benefit for our employees. The TCDRS is already a great plan in of itself, but the fact that we're going to move our contribution up on a go-forward basis is a benefit to our employees. And then finally, we are going to change our extended illness benefit to where we will no longer continue accruing additional hours into the EIB bank for our existing employees. The existing employees that do have EIB will retain their bank, and they can use it for as long as they're here. New employees that come on starting October 1st will have the option, along with existing employees if they want to buy short-term disability as a benefit, and that is standard within the market. So those are the big changes that we've got in our salary, wages, and benefits for this upcoming year. Now, when I look at total salary, wages, and contract labor, you can see where we've been over the last 5 years. Here's our budget for this upcoming year. $164,400,000 is basically what we're saying we're projected to spend in this category, which is a number comparable to this year. In 2019, we spent $172 million. So you can see we're down about $8 million from fiscal year 19, and we're now back to fiscal year 18's rates. And if you think about the rate increases we've done over the last 2 years, to show that we're coming in at 164 million, which is comparable to where we were in 2018, that's commendable on our wage control. But I will tell you, I do still have concern when I look at the number of FTEs we have, and you can see we're projecting 1,691 FTEs for this upcoming budget. This year, we're going to finish right at 1,656, but realize we furloughed up to 20% of our workforce in the April-May time period. And then we also had the permanent reduction that happened at the end of April. We go back to fiscal year 19, you can see we're right at 1,750. So we're running below that number. Now, I will tell you, within this number, there's probably 30 to 40 additional FTEs simply due to staffing ratios that we've changed related to COVID and trying to ensure that we have adequate clinical people serving the patients. We aren't at our standard pre-COVID ratios in some departments. And so we built that into our budget for this year. Now, what does that look like on paid FTEs per adjusted patient day? This is the hospital only, but this gives you an idea of what volume does and staffing we had to go through. Pre-COVID, 485, 477, 474. Even though we had higher volume and higher FTEs, our efficiency, this is an efficiency type number, we were at 4.74 paid FTEs per adjusted patient day. With this year's reduction in volumes, but additional labor that we had to put in, we jumped all the way up to 5.2. The budget has us at 4.94, and for us to get back to this type number, we would, and keeping the same number of FTEs we have in the budget, we'd have to have a census of 190. Well, we've never had a census, average daily census of 190. We spike occasionally, but on an ongoing basis, we're roughly about 180. So we're not going to get there on volume. If we were to reduce more FTEs, it's probably about another 75 FTEs. And so you can sort of see the dilemma we're in. We want to make sure we service our patients properly. And so we've built that into this. I would hope that once we get post-COVID with the vaccine, we could get back to these type numbers of 4.75, 4.8. That's where we really need to be. But until then, we're probably going to be in this range on an efficiency mark. Now, total operating expenses, and this excludes depreciation. So basically, this is cash expenses. That's the best way to think about this. This is total cash expenses for the organization. We've got $350 million in cash expenses for this next year budgeted. That's a little less than $1 million a day that it's going to take. With the expense reductions we put in place and the lower volumes, we're right at 350. Current fiscal year that we're closing out, we're going to be right at 358. In 2019, we were at $379 million. So you can see it's a significant decrease year over year from 2019. And we're really back to 2018 numbers again. All of this, for the most part, is coming at the hospital level. We're seeing pretty much a standard state going across here for ProCare, and that's just with the recruiting of physicians we have in there and the efficiencies that they've been able to get. We've been able to keep them at a fairly constant number. Now, let's talk about our funding for Texas Tech. As all of y'all are aware, we did sit down with Texas Tech, I want to say 4 or 5 months ago, and in fact, it was right in the midst of April, and said we cannot continue funding at the levels that we are. And the stance we took with them was no different than we took with all of our other vendors that we have within our organization. Every large vendor, we went and asked for and got anywhere from 20 to 25% reduction in their services. Well, Texas Tech was able, through a lot of work with Dr. Benelini and his group, to get us to that number. And so we've got built into the budget funding for this next year at $9.8 million. And you can see where that stands in relation to where we've been over the last several years. Now, I would expect this number to be continued to be reviewed as we prepare for the fiscal 2022 budget. With Texas Tech, we've got to work with them in partnership almost a year in advance as it relates to them trying to build their residency program, because they start recruiting for new residents in the October, November time period, and I think they want to have it resolved by December or January at the latest. That's about the right numbers I'm thinking as far as getting letters out and confirming it. So we're going to finish this budget, and then we're going to turn around and start back again with Texas Tech on the fiscal 2022 budget, simply because this is a long-term right sizing that we need to go through on this organization. And down here in the little letters, I don't mean to put it in little letters, but it just sort of shows you the transitions that has gone through between us and Texas Tech as different ways in which we funded it. Back in fiscal year 09, all of the resident funded was shifted to the community benefit program, or formerly the UPL. And so we took some of these dollars and we put it in the UPL to try to get monies from the government to help offset some of that. Then in fiscal year 11, the faculty funding was shifted to the community benefit, much in the same way to help offset this expense. Well, in fiscal year 18, we had to return all that back to the district simply because that funding had dried up. And so even though this is what we've been funding for the last several years, there was, via some mechanisms in the Medicaid supplemental, that we used to offset some of this. Now, there is no offset. We can't use it towards any other benefit. We do get GME, which is roughly $3.6 million to help offset some of this. So there's a net cost to us still in the $4 to $6 million range as it relates to Texas Tech funding. So in the budget, which we will approve after I present it, there is a place in which we'll have to come in and agree to this level of $9.8 million so that the new agreement with Texas Tech can be amended for the next fiscal year. Now, let's talk about the one area that I do like talking about, and that's capital budgeting. And we're going to put in the budget, though I don't have the definitions of what all the items are, $15 million for this next year. And what I'd like to be able to do is work with the E-team and the directors over the next 3 months and present to you guys in the January, February at the latest time period, a detailed 3-year strategic plan as it relates to capital. Because we really need to be looking not out just 1 year, but 3 years, preferably 5, but let's at least get 3 years down underneath our belt. Because I think there is a huge backlog of capital that we need to get spent that we haven't. I will tell you that we will have spent the full amount that we put in the budget for this year, which is good. Last year at this time, we woke up and realized we'd only spent $9 million, even though the board had approved 13. So we hadn't done our jobs as the management team, making sure that what had been approved got done. And within this $9 million was a $2 million plus Da Vinci robot just to get it up. So I mean that just shows you how far behind the curve we were on that. Well, we were very diligent spending the money this year, all right? And that's the only time you'll hear me be happy about spending money.
Watch yourself.
I know. But we did get the $15 million spent. There's one large capital project that wasn't done, and it was the Alaris pumps. And that's simply due to the fact that they're still on FDA recall. So it'll probably be something we do in fiscal 21 budget. But that being said, last year we had roughly $600,000 in contingency funds set up in this budget. Right now, we have spent $2.6 million in contingency funds. That just shows you the amount of emergency capital we had to approve over this last year due to the fact that we didn't spend money in these years right here. And these years, even though they look large, it's all Cerner. There isn't the surgical equipment, beds, radiology equipment, all the stuff that we should have spent because we spent it on Cerner at the time. So we're at this $15 million mark again in this budget, and we need as an organization to stay committed to spending at least $15 million. Now, that's if we're making the money. If we're not making the money, you can't spend it because you don't have it. But you sort of see the dilemma we're in. We've got to make the money. All right, ProCare. This is good. I mean, Brandon, I remember last year you had said we need to see improvement in ProCare. Well, I can tell you today that we've seen improvement in ProCare. All right, that's good. We've got more improvement to do, but we've got some good improvement in ProCare. So we're coming with a budget. It's buried down here in this bottom bullet here of $17.6 million. Now, within this $17.6 million is $1.6 million worth of new physicians that are coming on. So we've got 4 new physicians in this budget that will start or have started but haven't been here a full year, 2 orthos, 1 ENT, and 1 vascular surgeon. So if you look at these additional physicians that we're adding at $1.6 million, that's in the 17.6, our overall run rate for the budget for ProCare for next year is $16 million support. We're going to finish this year at $22.6 million support. So that's a $6 million improvement in ProCare. So it's not the full 10 that we'd like to get, but it's 6, and it's a significant 6. So I think the management team is pleased to report that a lot of work has been done. We realize there's more to be done, but we've taken a good first step. All right. Because if you remember, we've been in the $22 to $24 million range the last several years. So we've got a good budget here for ProCare for this next year. And we'll need to also approve the $17.6 million funding for the upcoming fiscal year. All right, tax support. This right here shows you the breakdown between sales tax, which is the blue, and the ad valorem tax, which is the yellow. And you can see where we've been over the last several years. I mean, fiscal year 18 and fiscal year 19, we had roughly $70 million in support. 70 million. This year, we're going to finish right at $61.4 million in tax support. So that's a significant decline. And our budget for this next year is at 62.7. So it is a slight increase if we collect all of the property tax, which, Don, you've opened my eye to that one. This right here, even though we're going to hopefully assess this amount, it still has to be paid. And that's going to be an issue that we'll look at in the January, February time period. But that being said, you can see I'm projecting our sales tax for the next 12 months at $38.4 million. That's the same low level as 2017. And if you just look at all of the trends that we have, when Grant and I take and trend out our sales tax and you run it out and you say, how long does the bust normally last? 38.4 is a pretty good projection. Right now, we're running 30% off of last year's tax receipts. 30%. So we've been consistently 30% for the last 4 months, and on average 25 for the last 6. So total tax support from Ector County is roughly $62.7 million. Now, where does that go? Well, let's talk about the unfunded mandate that we have as a hospital district. We'll spend roughly $2.5 million on Ector County jail inmates, providing reimbursement for services when they aren't treated here. At the Family Health Center, we'll have unfunded roughly of $1.7 million for this upcoming budget year. ECHD, indigent charity care at cost. This is where we're paying for people that need care at Oceans, at Rivercrest, at Texas Oncology. These are people that have no insurance that we're helping fund. That's going to be roughly $11.3 million. Then we look at uncompensated care at cost. We're in the $111 to $113 million range. Large chunk of this is bad debt expense. And now this isn't at full cost. This is at cost. This is what we would expect to receive or what it costs us to provide those care. So you add all that up, we'll spend between $126 and $129 million over the next 12 months. And if our bad debt goes up even more, it's even going to be more than $129 million. That's what this organization is doing. Tax revenues, you can see where we are, 62. So we have roughly unfunded $64 to $66 million unfunded. So yes, I realize we're assessing a lot of taxes between sales tax and the ad valorem, but we still have a large unfunded piece that we're providing to not only Ector County, but really the 17 counties that make up the Permian Basin. All right, so here's the final slide. And this is where, if all the things happen the way we've got them in the budget, this is where we're going to be. We're still going to show a net loss in income or net change in assets of $6.2 million loss. Now, this includes some non-cash items, which I tried to talk about last time. So when we add back the non-cash expenses, such as depreciation, the non-cash portion where we're expensing the retirement plan, $4.8 million, and interest expense, which is not an operating item, it's a debt service type item. We're going to have cash flow of $19.5 million. Now, a couple of weeks ago, I gave you a quick chart that said if we could spend 15 million in capital and we spend this much in debt, and we put about $5 or $6 million in the bank, we really need $23 million. Well, just given all that we've gone through in this budgeting process, and squeezing everything that we can and being as realistic about certain things, the best I can get at this point is $19.5 million. So we're still going to do the debt service, and this is a nice reduction. Remember, we're going to save $12 million over the next 10 years on debt service simply because we were able to refund our debt earlier this month and reduce our interest cost and our debt service. So we have $3 million in debt service we'll need to spend, and we'll need to spend 15 million in capital. So if we make 19.5 in cash flow and spend this, we'll be able to put $1.3 million in the bank. That shows you how slim of a margin we really do have on operations around here. I'd love to be able to tell you a year from now, we've put all $1.3 million in, and we're going to do everything we can to do that. But it very well be that we may not put a dollar in, just given some of the variations we may see as the economy keeps kicking us in the gut, basically. All right. And this 1.3 is roughly 1.4 days cash on hand. But that is the fiscal 21 budget in a nutshell. If you have any additional questions, you want to see any greater detail, I can break it all down for you.
Anybody else have anything for him?
I have a question.
Yes, sir.
What is the difference between the current tax rate and the proposed tax rate? What does that do to the budget? How much difference is that from current to?
Okay, if we go back here, it is $6 million. It's just the difference between where we are now and here, $6 million. But then look at where we're going to drop. We're at 53 million in sales tax. We're going to be at 38. We're still not going to make up enough in sales tax fall with the ad valorem tax going up. We're still going to be short.
Go ahead. I have a comment.
Yes, sir.
Let me just say just a few things. First of all, Steve and Grant, Austin, raise your hand, Austin.
Yeah.
Intern Austin. Okay.
Yeah.
He'll take, I just want y'all to know these people have
Worked.
busted their hump. Go ahead, Steve. I'll let you do it.
Yeah. So let me. I'm going to sort of steal your thunder, but I'm also going to give him. I have really 4 groups of people I want to thank with this year's budget. All right. First is this guy right here. All right. I've worked with a lot of CEOs. I really have. And this guy is pro CFO. I'll tell you that. I mean, not that he's going to let me off on anything, but he has been out in front of our directors from the moment we started this budget process, talking about what has to get done. I mean, he's continually being the lead cheerleader on how we've got to make this budget come in. And I haven't had too many CEOs over the last 35 years that do that. They all say, well, that's your problem. Go worry about it. I'm going to go do this. This guy doesn't. So my first thanks is to him. He's been a true advocate for making sure we do this and do it right. So I thank him. The second one is really the E-team and all the directors, because they've worked hard. I will tell you that Austin and Grant have asked them to dig into purchase services to a level that they've never had to dig into before. I mean, seriously, we spent probably 2 months going through purchase services, just trying to get that number down. And all the directors were involved, and they've all got comments. They've just worked hard. And no sooner did we get that done, then we flip onto them. All right, now here's a new way to do employee projections on what your staffing is going to look like. And it was a massive task to get that done. And we've worked with Matt and Kristen and Courtney, and I mean, we've worked with all the E-team and their directors. They all worked very, very hard to bring this budget in. I mean, it was them putting it together, all right? Now, the one sewing it together, I will tell you, is Austin. Austin, stand up. Austin needs some real recognition. I don't think Austin really realized what he was stepping into when he asked for an internship after his graduation. All right, but this young man, quite honestly, is the kind you want to see coming into healthcare. He shows up in my office and says, "I got what you asked me to do done," and it isn't 3 days later; it's 4 hours later. I mean, the guy is fast and he's accurate. And he doesn't sit around waiting for the next thing to happen. I mean, he says, "Give me something else. Give me something." You want that. You want that. And he's accurate and he's very, very smart. And I think all of the directors that worked with him and the E-team appreciated what he brought to the table. So I want to say thank you to Austin. Really, tomorrow is his official last day, but we're trying to find a way to keep him around. We'll see. He's going to go back to Dallas, see his girlfriend, and make some decisions there. But hopefully we can get him back starting October 1st to help with the capital budgeting piece we need to do. But if not, we do want to thank him very much. He's worked exceptionally hard, and we wouldn't have been where we are today without his help. All right. And then finally, Grant. Grant has put lots and lots of hours in, late night, early morning, weekends, crunching all this, he sewed it. He sewed it together. So I really am appreciative of all this. I get to be up here and just sort of tell you the numbers. But they've all worked very, very hard, and I think we've got a good budget, one that I'm pleased to present to the board, and as a management tool for us to work for during these difficult times. I think we've got everybody's support in having to do that. With that, I'll sit down and let you go on from here.
Thank you, Sal. And don't take anything away from Steve either. I mean, Steve and IDL and Matt and Kristen and everybody has just been, we've asked to squeeze as hard as you can squeeze, and we've squeezed it. We've done a lot of legwork out in the community. We've been out in front of people. You know, we're in there talking today about how many billboards. We're talking about billboards and needles. I mean, those don't even sound like they go in the same sentence. But when we've crunched this down, and I hope you guys feel that this budget is probably, from what the conversations we've had together, I'm hoping you feel like this is your most transparent budget you've seen in a while. We had a list of things we wanted to accomplish. Some of them we got done easy. Some of them we're going to fight all the way. But ultimately, what I've been telling the public, and I hope y'all heard from me, is we're not going to the taxpayer without having our house managed first, and that we've got it managed and we've got it under control, and everybody knows what's going on. And now this is where we are. So as much work that we have to put in this budget, unfortunately, next year's budget is going to require more, because we're going to be going off of this year's rates. We know this year's rates are going to be depressed again. So that is going to be a whole nother one. I told Steve, I said, you guys and gals, y'all take a couple of days off, regather yourself, and we got to come back in and start right to work on next year, because it's going to be tough. And we see oil and gas recovering. I had a board member one time over in Andrews tell me the only good thing about oil going down is it will come back up. And it will. The question is, how long is it going to go before it turns around? But the tax rate, it is what it is. The sales tax, it is too. I mean, the thing about the sales tax is you don't pay your electric bill.
That's what happens.
Whoa.
Time to adjourn then. Steve was out my queue to be quiet.
Took a little nap.
Whoa.
On the sales tax side, when Texas gets shut down and the world gets shut down, the sales tax is going to struggle. But I am the optimist all the way, and I believe that we'll recover, we'll come out of this. And our goal is to make sure we're in better position coming out of it than we were going into it. And I feel like this budget today is a very good step in that direction that puts us in better shape as we get ready to come out of it. I hope y'all can appreciate, make sure you tell all these people how much you care about them, because they have worked hard, been away from their families a lot, and have got this thing whipped into shape. And with that, we'll take any questions or comments, Mr. Chairman.
The only thing I'd like to say and add to this, that it's been really refreshing to have people that I can ask any question and get a real answer, and an answer that makes sense.
Good explanation.
That's right. So that hasn't been exactly that way, but I appreciate it being that way.
Now, let me ask one more question. The $2.5 million we spend on the jailbirds, if you will, why doesn't the county pick that up? Do y'all know, was that part of the agreement somewhere long ago?
That's what Russell told, or not Russell, Robert told me. It was part of the agreement.
When they get it goes.
Yeah.
Getting the sales tax and
Maybe we should renegotiate.
Well, now, some of that I thought was gonna be captured by a deal that they made with Texas Tech, but I don't know what all that's.
Yeah, I don't know, do we get all the bills? I mean, no matter where they go? we
No,
get
no,
the-
no,
Or is that just here?
that's if they get treated and aren't able to be treated here. That's if they're treated at the jail, that's my understanding.
So they're doing $2.5 million worth of work at the jail?
Yep.
So that doesn't count what we're doing here either.
That's right.
So that number is bigger than that. And I wonder, so, okay,
And we're writing a check. We are writing a check for that amount.
let me write this down. Renegotiate.
There you go.
Jailbirds, got it, okay, all right. Just a question.
We asked why we didn't have the people there. If that's
Yeah.
what the deal is, it would be a lot less money for us to have people there.
And you think you can control the cost a little more if you're on staff?
They said that they were, I remember the argument being that they didn't feel safe in that environment.
I will tell you that in San Angelo, Shannon has a very difficult time staffing that particular aspect of it, because they do that for the county.
It's pretty hard to get in jail to get treatment, you know?
You should know.
Just ask me, you know?
And then, can I make one last comment real quick before we go? I'd just like to say, over the last 3.5, 4 years that we've been part of the board, we've experienced a lot of transition and a lot of ebb and flow and flux in the leadership of the organization. And until this point, I feel that we finally have a solid, forward-facing group of professionals that are just, we feel comfortable as a board, finally, after all these couple of years, that the organization is in the right hands. So I commend all of y'all for y'all's hard work. Thank you so much.
I'll just add that, just what you're saying, and also what Don said, that for 3.5 years, we had questions, felt stupid to ask, or weren't given accurate information, and I appreciate everyone in this room, because it is so refreshing this last year. If I have a question, I don't feel stupid. I can text Kristen and ask her, and she doesn't, make me feel bad, or I can ask Steve, and if we have a concern, you address it, and it's just really nice, even if it's not a legit concern, that you address it. And, I very much appreciate your taking in ProCare and all the other concerns.
I agree with that. I've been on here a long time, and I learned more now than I ever have.
Wow, that's great.
You're gonna wake a whole lot.
Anything else?
Richard.
If there's nothing else,
Yes, oh, yeah, him.
if there's nothing else, I'll consider to adopt fiscal year 2021 operating and capital budget as given.
I'll make a motion for approval.
I'll second.
Motion and second, all in favor say aye.
Aye.
Opposed, same. Motion carries. Congratulations.
Barry, I had to do it.
Yeah, we need to do Texas Tech. So we need to consider approval of the amendment of the master credentialing agreement with Texas Tech University Health Science Center.
We don't have to listen to Dr. Merlini, do we? Because
No.
it would be a no.
make a motion for approval.
Second.
Have a motion and second, all in favor say aye.
Aye.
Opposed, same. That was easier.
Yep. And then we also need to consider the fiscal year 21 ProCare funding agreement as presented in the budget.
I move to approve the fiscal year 2021 MCHS professional care funding agreement as presented.
I'll second.
Ooh, don't second.
Have a motion in a few seconds, all in favor say aye.
Aye.
Opposed, same. That motion carried also.
And the last one.
And we're gonna consider approval of 2020 ad valorem tax rate.
I'll make a motion to adopt the ad valorem tax rate of 0.019441 for 100 valuation for interest and sinking fund, and 0.130559 for 100 valuation for maintenance and operations, with a total tax rate of 0.15 for $100 valuation for tax year 2020.
Now, second.
I have a motion and second on the ad valorem tax rate. All in favor, say aye.
Aye.
Opposed, same.
Nay.
Motion carries. Thank you.
That's
Thank
it.
you.
That's it.
Oy, 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 oy.
Good work.
Thank you very much.